Hey, it's Deacon Matt, and I wanted to come to you again today with another coronavirus quarantine update. It's been a week since I posted my last little video update, and so I want to let you know how I was doing. Still doing well, still feeling really good, have not developed any additional symptoms other than what I reported last week, and those have started to diminish. The lack of sense of smell, which is really, I guess, my primary symptom, has gotten a little bit better. It's starting to come back somewhat. It's actually funny what I can and can't smell right now. My wife was making a lasagna for Sunday lunch yesterday, and I could smell that like halfway across the house. In fact, it kind of caught me off guard. I was walking through the kitchen and I said, that smells good. And then I heard what I was saying, and I thought, that smells good. I can smell it. It kind of struck me by surprise. But then there's other things that I can't smell at all. So the essential oils that we have in the house, the soaps that we have that my wife makes, either I can't smell those at all still, or I can smell them very, very faintly. So again, I can smell some things and not others, but I'm just grateful that that's coming back. I reported last week having a very mild runny nose, and that seems to have gone away for the most part. I'm still not convinced that wasn't just because of the cooler temperatures and, regular seasonal stuff. But otherwise, I'm feeling good. I haven't developed any new symptoms. I'm still sleeping well. I have good energy. I don't feel sick at all. And no one else in my family feels sick. The kids, Joni, none of them have developed any symptoms. They're all doing really well. So praise God for that. I found out last week, reading in the paper, that Jackson County had a record week that week, or last week, I guess, in terms of new coronavirus cases. It seems to be on the uptick. So I guess my case was part of that number. It just kind of goes to show that this thing is out in the community. It is community spread. When they called me from the Jackson County Public Health Department, and they were kind of asking me questions about where I've been and where I might have been exposed. Of course, I mentioned that I worked on the college campus, and they pointed out to me that a very high percentage of college students and college age people, young adults, never show any symptoms at all. They have it and they're asymptomatic. And so that means that there's probably a good number of students walking around campus who simply have no idea that they've been exposed to it, that they have it, and that they're spreading it because they don't experience any symptoms at all. So it's just safe to assume that at least when you're on campus, that everybody has it. Treat everyone as if they have it, and so all those protocols that campus has in place, they're there for a reason and should be followed. They did ask me when they called from the health department about people I had been close to for contact tracing purposes. They defined that as people that I had been within 6 feet of for longer than 15 minutes. And when you put those parameters around it, it was actually very few people that I had to report to them for contact tracing purposes. Now, on my own, as soon as I found out that I had a positive test result, I went ahead and contacted everyone that I had any sort of contact with at all over that previous week, even if it was just fleeting contact. And that includes people that I administered communion to at daily mass on that Thursday and Friday. And so far, none of them have reported back to me anyway that they've tested positive. So what that tells me is that the protocols that we're following when we administer communion at church are doing their job. They're working, sanitizing our hands in between every communicant, wearing masks, having the communicants wear masks. I was very relieved to know that those protocols are working, and yes, and also the doctors told me when they tested me, and the health department reaffirmed when they called me. They want me to quarantine from 10 days from when my symptoms first began, and that would mean that my quarantine period would end tomorrow. However, my supervisor with the diocese, the director of campus ministry, as well as Father Paul, have asked me, and I agree, to go ahead and stay home for 2 full weeks, 14 days, before I return back to campus, back to church, just to be extra cautious. And I think that's a wise thing to do. So the procedures that we're following here are actually going above and beyond what the county health department and what the CDC are recommending. So it's good for me to know that. So we want you to know that church is a safe place to be, and our campus ministry center is a safe place to be, and we're, if anything, following more strict protocols than what the recommendations are. So yeah, that's it. That's my update. Again, I'm doing well, and my family is doing well. People are checking in with us every day just to see if we need anything, if we need any errands run or anything like that. And so I appreciate all the support from family and friends. I appreciate all the continued prayers, and know that I'm still praying for you guys. And I look forward to seeing you back again this Sunday. God bless.